Hi, my name is Jinhee Park, and some people call me Dr. Park. I'm an integrative medicine physician, a traveling doctor, and I also practice medical acupuncture in Northern California. Today, I wanted to share with you my story of getting into fitness and also overcoming my chronic low back pain problem. Um, Ever since I was a little child, I've always wanted to go to medical school, become a doctor, so I could help people who are sick, in pain, relieve their suffering. So I worked really hard during undergrad and went to medical school. But during that time, I was very stressed out, and I developed a overeating habit. I was an emotional eater, and I had a lot of access to a lot of junk food during college. So even though I was, wanting to study medicine, I was not really healthy at all, and I gained a lot of weight during college and in the first couple of years of medical school, and was about 55 pounds over my ideal weight. So in medical school, being overweight really led me to feeling very, have low self-esteem, and I was very insecure about myself, had poor confidence, and it really affected my school performance. So after talking to a school counselor, I was advised to kind of take some time off from school to kind of work on my well-being. And during that time, I joined a 24-hour fitness gym and went and wanted to start, getting healthier. But when I first went to the gym, I saw those, those weights and machine equipment. I had no idea where to start. So I was looking around. I met up with this personal trainer who told me that they were having a special personal training deal. So I took out extra student loans to invest about $4,000 to get a series of personal training sessions to really learn and commit myself to a healthier lifestyle. So by the help of the personal trainer, I was able to revamp my diet and really cut out all the sweets and the junk food, processed food from my diet, and replace it with healthier foods. And she also taught me how to properly do strength training using weights, with proper body alignment. She also encouraged me to join a marathon training group and really sign up for a marathon in about 10 months, so that I could have a definite goal to work on to really keep me motivated. So I followed her instructions. I was doing really well by following her plan. I was shaving off about 1 pound a week for 40 weeks in a row, and I was able to drop about 40 pounds and run a complete marathon after 10 months. And I became very confident in myself, became in really good shape, and I continued to run more races for another couple years. And I went back to medical school, and I was able to finish medical school with better uh, in a better state. Um, in between medical school and residency training, I decided to spend a year doing a yoga teacher training in New Orleans because I got into yoga. It was very healing, and I wanted to really study the ins and outs of it. So I spent a year living in New Orleans, and I lived next to this yoga studio called Wild Lotus Yoga Studio, and they had a really great yoga teacher training program. And by doing that, I had access to all kinds of yoga classes from that studio that were offered, and they were ranging from like gentle beginners yoga for elderly people to prenatal yoga to Shakti power yoga for advanced yogis. And I really enjoyed that year learning about the anatomy and physiology and philosophy of yoga. And I spent about 3 to 5 hours every day practicing yoga and dropped another 15 pounds and got into the best shape of my life. Became very flexible as well. And during that time, I also studied to become a personal trainer myself because I had benefited from learning from another personal trainer how to eat properly, how to exercise. I wanted to be able to help other people to do the same. So I studied for the National Academy of Sports Medicine personal training program, and I got certified as well, and I was able to work part-time helping other overweight people achieve their healthier weight. And also during that time, I was applying for residency programs, and I wanted to go into family medicine residency because I wanted to apply my knowledge about holistic preventative medicine, nutrition, into practicing medicine as well. And I matched into University of Southern California family medicine residency program in LA, and I went there, and it was like a total disaster. It was like an 80-hour per week work schedule in a hospital and clinic where it was all about pharmaceuticals and prescribing like surgeries to very, very sick patients. There was hardly any emphasis about prevention or healthy diet or, exercise or lifestyle modifications. And during that time, again, I was surrounded by a lot of toxic people, a lot of stress. So I was not eating properly again. I was not sleeping well. I was only sleeping maybe 4 to 5 hours a day, and I was on a very odd overnight call schedule. So I would work at night and then like sleep during the daytime, which didn't give me good rest. So I felt like my body was starting to fall into pieces again. And towards the end of my intern year, I had a very severe low back injury that led to excruciating low back spasms for months. And I suffered from like really bad low back pain for about 10 months. And even one day, like I was walking through the hospital lobby, and because of the excruciating low back spasm, I fell down to the ground, and then I was transported to the emergency room because people thought that I was having a heart attack. And in the emergency room, the emergency medicine physician saw me and told me, "Oh, yeah, 90% of the cases of low back pain cases get better on their own. Why don't you just take this pain pill and this muscle relaxant, and then you just stay here for another like half an hour, and then you just go home and see how it goes." So that day, like I remember getting out of the emergency room and going back to my clinical duties, and then while I was walking out of the emergency room, having another spell of excruciating low back spasm that led me to falling down on my knees, and I had to call my senior resident to cover for me, and then I just had to go home, just crawl back to my car and go home, and I was just talking to all these MDs. I was surrounded by all these MDs in this hospital who were like world class, known to be world class doctors, but none of them could really help me, and all they could offer was just pharmaceuticals and refer me to physical therapy that didn't really help that much. So I was searching for answers, and finally, one of the yoga teachers that I personally knew recommended seeing a Chinese medicine doctor. So I found a Chinese medicine doctor in Santa Monica, and I went to see her because I was so desperate to get better. And after a few sessions of acupuncture and getting herbal treatment by her, she pointed out that like all these musculoskeletal injuries were related to poor liver and gallbladder function, and she gave me herbs that really addressed those issues. And after getting that treatment, miraculously, I was so much better. I no longer had the low back spasms anymore. I didn't have any pain, so I was back to my normal functioning again. And from that point, I just felt like, okay, as a doctor, like just being trained in Western medicine alone wasn't really enabling me to help a lot of people, So I signed up for a training course for physicians in acupuncture and Chinese herbal medicine myself. And after a year and a half, I got certified to practice that as well with my California medical license. So after my training, I opened up my own private practice in Northern California. I've been treating a lot of low back pain patients using my expertise in personal training, yoga, and Chinese herbal medicine and acupuncture. And I've been very successful weaning people off of pain medications and also preventing them from having back surgeries. So today I wanted to share this message with you about my personal story. And for those of you out there who may be currently suffering from low back pain, I just wanted to let you know that there is hope with different modalities of medicine. If you know of anyone who sees this video who might be benefit from watching this video, please feel free to share this video with them on their Facebook page as well. Please leave any kind of comment, any frank comment, if you like it or not. I would really appreciate any kind of comments about this video. And from now on, I will be posting more videos about holistic healing of low back pain, how I view as the most effective treatments using nutrition, herbal therapy, adequate exercise, and mind-body techniques, and ergonomic lifestyle. So stay tuned and have a great day. Thank you very much.